Welcome to the ListenUp podcast, where we explore hearing loss, communication, connections, and health.
Hey everybody, Dr. Mark Sims here. I'm the host of the ListenUp podcast, where I feature top leaders in medicine and healthcare. This episode is brought to you by ListenUp Hearing Center. I help patients to effectively treat their hearing loss so that they can connect better with their friends and family and remain independent. The reason I'm so passionate about hearing loss is I lost my brother Robbie twice. First to his hearing loss from radiation to his brain tumor, and then when he passed away. I only care for ears. I'm the E of ENT. I performed over 10,000 ear surgeries over the past 20 years and taken care of many more with hearing loss. I'm the founder of ListenUp Hearing Center, and I'm author of a book of the same name, Listen Up, A Physician's Guide to Effectively Treating Your Hearing Loss. If you want to learn more about that, go to listenuphearing.com. Today, I have a guest. We're featuring patients as our guests to share their experience. I have Mr. Mark Lorigan. He spent 4 years as a medical corpsman in the Navy. After the Navy, he earned his BS degree in biology and worked in the pharmaceutical industry in medical sales for 27 years. When Mark experienced a sudden and dramatic loss in his hearing in his right ear and the symptoms became persistent, that's when he decided to seek medical care. Now he wants to help increase awareness of hearing loss and ear problems by sharing his journey as a person with hearing loss. This is great. I really appreciate you coming on the podcast, Mark. Thanks for coming on.
You're welcome. Glad to be here.
So, you were minding your own business, and then one day something happened. So tell us your story.
Okay. Well, the first appointment that I had made to see you, I had an effusion, I guess, in my right ear.
I'm sorry to interrupt. Backing up a little, you were doing normal, and then what happened to you before you? What prompted you to come see us?
Well, it was just difficulty in hearing for multiple reasons.
In one ear, though, correct?
That's correct. Just in the right ear. It just seemed like it was almost I was deaf in one ear, and I was really alarmed and surprised that this was actually happening. So that's
did it come on suddenly, or did it happen gradually?
Pretty suddenly, yes.
And so how long did you wait for it to kind of settle in on its own, or to try to resolve on its own?
It was about 2 months was the time period for.
All right. So I'm sorry to interrupt, but I just wanted to set up for the listeners. So then you came in and you came to see us, and go ahead with your story, if you would.
Sure. And in order to take care of that effusion, you had a tube put in my ear and drained it. And so with that, all of a sudden, miraculously, I was starting to hear better out of my right ear. At least that's the report I got from my wife. So from that aspect, I thought, okay, this is good. But at that time also, I took a hearing test, which I don't think I'd ever had one before. And of course, at my age now, 74, I just probably being in denial is probably the best reason I can think of, or maybe selective listening. If anybody has a spouse that's listening to this, selective hearing or selective listening, at least that's what I called it, until I started really looking into it and being cognizant of what I was missing out on. I was constantly asking my wife to explain what she was saying when I should have gotten it the first time. And also things on TV, some other things that would go on in large groups where people were chatting. I could only concentrate on one. I don't think I was lip reading. I think I was just concentrating to the point where if anybody said anything else, I didn't hear what they said, and
Sure.
I didn't respond, in fact, at that time. So with that, it's just once I started to recognize that, and after the hearing test that I had, I thought, oh, I think it's time to stop denying it and recognize that I actually did have a problem.
Yeah. So for the listeners, what Mark had was he had fluid behind his eardrum. And so his history is interesting. And one of the reasons I had him come on is he had a hearing loss, and then his hearing got worse in his one ear, which then made him realize that he had a pretty significant hearing loss. And so after he had the tube placed and the fluid gone, one of the things he kind of complained of is, I have hearing loss. And the thing was he probably went back to his pre-fluid behind the eardrum level, but now because it had dropped and not returned to kind of normal, he was now more aware. Is that a fair statement?
That's fair. Yes. Most definitely.
All right. So In terms of the things that, with your wife and your peers, did anybody else indicate to you that they had thought you had a hearing loss previously?
Yeah, some of my friends, when I had to ask them to repeat themselves, not constantly, but every once in a while. And uh, my sister made a comment to me about it, and I basically just kind of blew it off. I just I thought, no, I don't really have hearing loss. I think I hear everything fine. And then after the test, that was taken. Uh, then all of a sudden, I realized that it was actually happening, and that I needed to do something about it. And again, it's like you never know what you're missing.
Right. You
And
don't know what you don't hear, right?
that's it. That's it. And so after I think I've had the aids now for about 2 months, and really, I'm hearing a lot of things that I I didn't hear before, like my feet shuffling on the floor or my arm rubbing against something, and I'm hearing it, and I thought, oh, that's kind of interesting. I haven't heard that in a while.
You almost forget they exist, right?
Oh, most definitely. Yes. You just kind of figure, okay, well, that's just part of the process, I guess. And it's just, again, ignorance is bliss a lot of times. It's just better to close your eyes and not think about it.
Were there
So,
any other noises that you hadn't heard that you now realized that you had stopped hearing? Like birds. Sometimes people say, I haven't heard birds in a while, or
uh, that, like our fountain out in our backyard, now I can, when it goes on, I know exactly when it goes on, and I can hear it from inside the house, where before I couldn't. I could only hear it when I was outside. And so little things like that, things with my vehicles. I've got very loud cars. And there's a lot going on inside the car that because of the noise of the car itself, I didn't want to miss out on, as far as making sure it was tuned properly, et cetera, et cetera. So with that there was some difference there also.
yeah, some people say they hadn't heard the turn signal clicking for quite some time.
Yes, most definitely. If it's not beeping, then I'm not hearing it.
Right, right.
That's
And
right.
so, one of the things you mentioned was in terms of asking people to repeat themselves. Is that gone down?
It appears to have, yes. And again, me being a little more cognizant of the fact that I do have some hearing loss, that I seem to be concentrating on conversations a little more critically. And I don't think I'm lip reading. I don't think I've progressed to that point yet. But just things around me are just, I don't know, a lot more expansive, fulfilling, if I can use that word. But all in all, it's been a unique experience, and one that I would definitely be positive about, and say good things about it. But other than that, it just again, as I said, denial. Not the river, in Egypt. So with that. I was impressed that they did more for me than I thought they would. I just thought, oh, great, here I am. I'm going to be wearing these doggone things, and people are going to look at me like an old man, and I'm losing my hearing and my eyesight and everything else. And so it just, but that went away right off the bat when I started hearing stuff that I hadn't heard before.
Well, it
So,
sounds like your friends already knew you had hearing loss, so it might be the opposite now, that they don't see it as much as they did before, now that you're treated.
yes, it certainly appears that way. Yes.
That is great. I mean, do you feel more socially attached or engaged now that you have?
Well, I tried to be as engaging as possible. I was in sales for 27 years, and I always had to listen before I spouted my opinion or my expertise, if you say. And so with that, I think maybe I am, but I haven't really recognized it yet. So let me put it that way.
How about your energy? You feel more energetic?
Um, I can't say that that's a plus any more so than before. I've always been very energetic, and so with that, it's kind of
Sure.
like a routine. And so with that, if I am, I haven't recognized it
How
today.
about your sister? Have you seen her?
I know primarily just talk to her on the telephone.
Okay,
And
well, hopefully
with
the
that,
next time you see her, she'll be happy that you got your hearing treated, right?
Yes, I'm sure she will, because I'm sure she said multiple times in the past, which I probably blew off and said, "Okay, sis, I understand."
Yeah, one of the things I tell patients is the people in your life who would tell you that your zipper is down are the people who will tell you of hearing loss, right? So it has to be somebody who's close enough to you that they're willing to kind of take that risk, because I mean she's still going to be your sister either way, right?
Right,
And so
correct.
she
Yes.
takes that risk to tell you, right?
Yeah, I think the determining factor too, of course, being my wife, because she's the person I spend most of my time with, and it just just as long as she isn't at the other end of the house talking through two or three walls, then I'm picking up what she has to say now. Where before I picked it up, but I picked it up in sections. I'd maybe hear the first part of it and thought, well, maybe I'm not interested. I'd stop listening, or I'm not sure what it was, but I think it was probably not hearing the rest
No,
of it.
you weren't hearing. The thing is nobody should be able to have a conversation from 3 rooms away through 4 walls, right? But I understand what you're saying.
Yeah.
And so I assume she's very pleased with you having treated your hearing loss.
Oh yes, and it's I'm not sure if it's a "I told you so" moment, or or "I've been telling you to do this for years. Why haven't you done it?" And then now that it's behind us, it's I can laugh about it and think, okay, fine. I'm sure majority of people I know that have hearing loss. I said the same thing to them that they have said to me in past. So again, we were kind of in the same ballpark, so to speak.
So do you wish you had done it sooner?
Um, I, yeah, I think so. It's just, but again, I needed that impetus to get me into your office with that eardrum problem that I had and lost. And I thought, oh boy, if this is hearing loss, I don't want to have anything to do with it, because I just lost it out of my right ear. And I just thought, oh, geez, is the left one going to be the next one in line, and I'm going to have to start reading lips? I don't know. So,
Well, for the audience, though, think about how many people probably are walking around with hearing loss and don't have, I mean, I wouldn't say the good fortune, but the incident of getting fluid behind their eardrum, which then made them realize that hearing loss would be bad, right? So my point is imagine how many people are in your position pre-fluid being told that they need their hearing, something to do about their hearing loss. They need their hearing loss treated, and they're just kind of, oh, well, ho hum, right? So
that's right. That's right. And people, when they start losing their eyesight as we age, as far as having to wear cheaters, to be able to read the newspaper and stuff like that, people have no problem doing that. I mean, yeah, sure. Okay, I had to go out and get glasses because I couldn't see where I was driving, or I couldn't read the newspaper, or this, that. They have no problem with that. But it seems to be, I don't know, maybe in my own mind, it was a much bigger leap for me to go ahead and have the hearing test and admit that I did have hearing loss.
Yeah, I think one of the differences is when you look at an A and you can't see the A, you're aware that the A is there, but you can't see it.
Correct.
That's the difference with hearing loss, as I always say, is you don't know what you don't hear. So it just disappears for you, as compared to, oh, that's not the right. In other words, you stop sensing it, as compared to a distorted sensation with vision when you know what an A or a B or a C is supposed to look like. So,
Sure.
yeah. And the other issue, obviously, is the gradual nature of it. Most people don't know they're losing their hearing because it's so slow. And so I know you commented that you don't know how to lip read, but you do to some extent. One is people develop lip reading when they're a child, when their parents are holding them and talking to them, they're starting to learn lip reading, and it's part of normal communication. Now, you might not, actively know you're doing it, but you probably are. And so, you were able to compensate to some extent, but then you put fluid behind your ear and you're like, I can't function.
Right. Correct. Yes.
And so if there were people who are on the fence thinking about, getting their hearing tested, or they've been told by somebody, what would you tell them? What advice would you give them?
Well, first of all, I'd say, well, it's painless. So that's a big plus.
And you need to get it measured, right? In other words, you don't know what it is until you get it measured, right?
That's right. And you might not have a problem. And it might be something other than just simple hearing loss that would need a hearing aid, or and get over the stigma, if I can call it that, of having to wear a hearing aid, either be it the little tiny guy that goes into your ear canal, or one that's a lot more sophisticated that seems to work a lot better with the one that sets behind the ear. So with
Yeah,
that,
I mean that the size and configuration depends on the extent of your hearing loss as well.
yeah.
So some people have a severe hearing loss that they can't put the one in their ear, and there are various reasons about sound and physics that just prevent that from happening.
Yes. Mm-hmm.
And so, one of the questions I ask everybody is what's your favorite sound? And it could have been the sound that you listened to before you got your hearing treated, or a sound you listened to after you got it treated. But what is your favorite sound?
Oh gosh. That's a hard one. If it's one particular sound,
You can name multiple.
okay. Well, of course, I listen to a lot of music, and I think maybe hearing the words that I maybe augmented something else or put that in its place, and I went, "Oh, I didn't realize that was the word that was in that particular music."
So the lyrics are sounding clearer to you, is what you're telling me.
Correct. Yes. Yes. Most definitely, and that's really important to me because I enjoy music so much, and also doing things, as I said, with my vehicles. That's really important that I, in fact, just stand there and just listen and pick up stuff that I didn't pick up before, like a valve knock or some flat spot on a camshaft or something like that. That now would be easier for me to detect than it would be before I got my ears taken care of.
Yeah, no, I mean, certainly I think it's great and admirable you're willing to talk about it. The recommendations are actually to start getting hearing tests in your 50s. And so, obviously, you've been diagnosed and treated. So I think it's wonderful. But for anybody watching this, you really should be looking at getting your hearing tested in your 50s to kind of get a baseline to see. And especially if you have a family history. I forgot to ask you, did either of your parents have a hearing loss that you knew of?
Not that I was aware of. No, my dad passed away at 63, and he didn't ever talk about hearing loss. And my mother either. She died at 79. And again, same situation, never had a hearing loss problem. So you always hope that, that the same thing will apply to yourself. If your parents didn't have it, well, then you're not going to get it. Well,
or perhaps they were in the state you were, that they didn't realize they had it, but they were doing, they were compensating for it. Right. And so,
I think so.
So that's great. Do you have any other advice for anybody who has hearing loss or what they should do about treating their hearing loss, Mark?
Gosh, I don't, it seems like we covered quite a bit. Myself personally, I would say, get over the stigma, that I felt that, oh, no, hearing aids are for older people, older than I am, even though I've reached that age, it's still older, 80, 85, 90, you keep pushing the envelope. And that really doesn't do you a lot of good because, again, you never know what you're missing if you don't hear it. And as I said, there's some little things that I'm sure you'll probably make me think about it a little bit more now. I know I'm hearing better, but I'm not really defining particular things that interest me. Just kind of the overall picture of being able to hear somebody's conversation and to be able to respond without having to say, "Huh? What'd you say?"
Well, that's not true because you talked about the lyrics and the sounds in the car, and those are really important things to you, right?
Mm-hmm.
And so, I guess the flip side of it is what did you miss in your vehicles before that because you couldn't hear them, right?
Yes, correct. Yes.
And how was your experience as a patient at ListenUp Hearing Center? How was it?
Oh, it was very pleasant. Just working with Laura, and she just has taken little steps at a time. Just how is it? Try it. Do you hear an echo in your head? And I'd get to the point where I'd say, yeah, and she'd back it off a little bit. She wants to take it very, very slowly, which I think is good because there's so many places out there now, like Costco, for example, where you just walk in and, oh yeah, you've got hearing loss, and boom, they want to sell you a $1,500 or $2,000 hearing aid, but they don't want to follow it up and get it so it's tuned so you can hear much better everything that is important to you. Where going there and just picking them off the shelf and thinking that they're going to work, I don't think is the right way to go about it. Although I do have some friends that have done it, and they said it did make a difference. but
which means they hear less bad.
Yes. Yeah, that's one way to
Right?
look at it. Yeah. Yeah.
Which is different than hearing as best as possible. And so somebody like you is looking to hear as best as possible because you want to hear the lyrics, you want to hear your car and all of those things. So it's kind of a different philosophical approach to the of treating the loss, right?
Yeah, most definitely. And it just, so from that aspect, I just figured if I was going to do it right or don't do it at all, because it'd be a waste of my time. And so that's why we went the route that we went. And I'm pretty satisfied so far. And I'm going to, as I said, concentrate a little bit more on some of the little things that I think I might not have heard, but I'd like to experiment with a little bit where I take them out and do the same thing and see what the physical difference is. And
yeah, it's going to be hard because your brain is adapting to the hearing aids.
Right.
And so, it's just going to be a challenge for the listeners. It takes, several weeks into months for your brain to actually to adapt to the new sound that it hasn't heard. And so, it's hard to like take them out. It's not like opening and closing your eyes. It's not quite as simple, but I understand what you're saying. In other words, test how they help you and realizing that. I mean, from my perspective, if you don't realize that they're doing anything for you and you're just cruising through life communicating effectively, that's a great treatment, right? One that you're not even aware of on a day-to-day basis, that there's a difference.
Right. And as Laura made a comment, she said a lot of people will get hearing aids and then not wear them. And not,
Right.
And it's kind of like, well, why'd you waste the time in the first place? I think once you make the decision, make it and do it and utilize it. That seems important to me, and it's kind of echoed with the hearing aids that I've got.
Well, one of the reasons is because they're not programmed correctly. They don't actually give them any benefit, and so people don't want to wear things that don't help them.
That's
and
right.
So, but maybe they have somebody in their life who keeps on saying you need to do something about it. So now they can turn and say, I did do something about it, and they didn't work, and that actually becomes maybe the worst situation.
Right. That's a poor excuse.
Well, fair enough. I don't disagree with you, but I suspect you have friends who are in that circumstance.
Oh yes. A lot of friends are my age, and my neighbor, for example, he went out and got his right before I had my hearing test, and his experience was kind of interesting with what he went through. And but all in all, he's gotten to the point now where he has got him in all the time because I'm always saying something to him when I make a comment. And he looks at me kind of with question. And I always yell at him, you got your ears in? He goes, yeah, I'm fine. I've got them in. So he says now he's wearing them a lot more frequently because, again, he was the same situation. He was missing out on a lot. And a lot of conversation was primarily what he was missing out on.
Yeah. I mean, at some point, I don't know if she's there yet, but Laura will actually measure and demonstrate to you that your hearing loss is treated. In other words, demonstrate graphically that it's treated, and that's probably where your neighbor might be missing out. That's why I always say they're hearing less bad, not hearing well, right? And so,
Yes.
But everybody has their own experience and has to kind of figure that out.
That's right. Whatever makes you comfortable, right?
Yeah. Well, I mean, unfortunately, one of the reasons this podcast exists is because I think people don't know better, and so that's part of our mission is to help educate people to understand. I mean, the statistics are actually pretty bad. Only 2.5% of hearing aids out there actually treat people's hearing loss, which means, which means more likely than not, your neighbor doesn't have. And so, you could tell him he can drop by and Laura can do a measurement to show him if his hearing loss is treated well or not.
Mm-hmm. Okay.
And that's to all listeners, that measurement can be made. So, well, Mark, this has been great. I really appreciate you sharing your experience with us and coming on and talking about it. And so one of the reasons I had written down your name was because of how you had a hearing loss. It got worse with the fluid. And then we reversed the fluid and you still had a hearing loss because now you were aware of it. And I thought that was an important thing to share with people because there are a lot of people walking around who have a hearing loss. They're being told they have a hearing loss, but they're not aware of their hearing loss. Does that make sense?
Yeah, it certainly does. And I've got a question for you that I was thinking about before the podcast actually started. Do you see more men needing hearing aids versus women of the same age?
So statistically, presbycusis, which is the hearing loss of aging, is more prominent in men than it is in women. So it's not just that there are more men who need it because they have wives who are telling him. It's genetically it is more prevalent in men than women, but it's common in both. And so one of the most common things, which I don't know if that's happened, is that very wonderful lady in your house who helped you set up the camera and everything. She probably needs a hearing test too, because sometimes the experience is the worse ears are the bad ears, and the less worse ears are the good ears. In other words, people use the couple, whoever hears the best is normal. Well, that's not always the case. Oftentimes it's one has some mild hearing loss and the other one has a more severe hearing loss, if that makes sense.
It does. It does. I know as you were saying, my wife was spurred on by having a hearing test the last time. She went with me to get to the adjustment, and she ends up having a what'd they call it, Connie? A high-end hearing loss with
high frequency, which is
high frequency. Yes. And we had known that for a while because we'd go to concerts and she couldn't make out any of the words. And I mean, it was loud enough at a lot of these rock and roll concerts that I could hear perfectly. At least I thought I did at the time. But she'd all of a sudden, it'd be all garbled because it was so loud. It was garbled. But then you could talk to her normally and she'd be fine. So,
well, with a high tone hearing loss, you don't hear the consonants as well. You hear the vowels. And so people are talking to you, but the parts of words that give them meaning are missing. And so that's what was happening to her.
Okay. All right.
So yeah, so you are in a testament. So that's why I would say, oftentimes the spouse should get their hearing tested as well. So it sounds like you're all buttoned up and Laura's done a great job getting you where you need to be.
Yeah, she certainly has. And I'm looking forward to even getting it tuned a little bit better. Not that I'm missing anything. I just
we continue to tune them and we continue to monitor your hearing to see if we need to adjust them, right? Mm-hmm. Because it's a medical problem and medical problems should be monitored. And so we will continue to monitor them and measure your hearing and see you on a regular basis.
Okay, sounds good.
Yeah. All right. Well, again, thank you so much for coming on the podcast. I really appreciate it. Everybody, this has been Mark Lorigan. He's a patient and he's sharing his hearing experience with us. And again, I appreciate you coming on the podcast.
Okay. Well, thank you for the invite.
Thanks. Have a great day.
You too.
Thanks for tuning in to the ListenUp podcast. We'll see you again next time, and be sure to click subscribe to get updates on future episodes.